Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas. Hey everybody, it's Dr. Reiser. We're back with Whiteboard Wednesday after our breaking news yesterday about the coronavirus. We're going to talk about some more common issues today. And as you can see behind me, it's a crappy situation. So I drew up a little bit of a bowel movement here on the board, and that's because in my practice, if you are a patient, you absolutely know that every time you meet with me, I always ask, how have your bowel movements been? Our bowels can tell us a lot about disease, our health, how our bodies are functioning. If you're looking at any type of disease, you always start in the gut. So one that we always talk about with our patients, and it seems that most people don't even know they have it, is irritable bowel syndrome, or IBS. So at the top here, I have some symptoms: gas, bloating, abdominal pain, diarrhea, constipation, and those are the two keys, alternating periodic episodes of either diarrhea or constipation. So to get diagnosed with IBS, it's kind of complicated. You have to have a lot of markers that show up, and they have to basically match with the symptomology. So really what you'll see is if you have abdominal pain about 3 times a month or more, and it has to match up with the following. So if you have abdominal pain that gets better when you defecate or have a bowel movement, or you have abdominal pain when your bowel changes frequency. So if you get constipation or if you get diarrhea, the abdominal pain comes on with that. Or you have abdominal pain with consistency of the bowels. So that means that when the bowels do get harder or get softer, you start to have abdominal pain. So abdominal pain 3 times a month or more, plus one of those 3, generally you can consider yourself having IBS. Now, historically, IBS used to be a problem with the mind. So most people thought that anxious people or depressed people, this would cause irritable bowel. And more likely than not, you've heard this because it is always a trigger for IBS when people say, when I get really stressed or when I'm anxious, I tend to have abdominal pain or my tummy hurts and I have diarrhea or constipation. Well, reality of that situation is it's actually the reverse. The reason these people are depressed and anxious is because they have IBS, and it's obviously uncomfortable, uncontrollable, and the reason for the majority of the mood swings and those types of things is obviously this is uncomfortable, but your gut has to talk to your brain, the enteric nervous system. So you have neurotransmitter functions going back and forth here, and we're finding that the IBS is actually leading to these mood issues, and that's very common for just any type of gut-brain connection. We see this all the time in our practice where anxious people tend to have dysbiotic guts. So at the end of this video, or right now actually, we're just going to talk about the real reasons, the 5 reasons that you have IBS. If you go to your conventionally trained doctor, typically you're just going to get some suppressive medication, and that's going to be an issue because the causes of this are not going to be taken care of by the meds. You'll get SSRIs, you'll get anti-spasmadics, you'll get laxatives, depending on the situation. And as we know, if all these things are going on, there's not one medication that can fix every one of these symptoms. So what are the 5 things that cause IBS, the 5 things that we see in practice that can cause IBS, IBD, irritable bowel disorder, any of these things? Okay, so let's take a look. So number 1 is going to be the easiest one, and this is because 83% of people with IBS suffer from this. And that first one would be gut dysbiosis. So all that means, and we've been over this time and time again in all of our videos that are related to the gut, is bacterial issues. You have a bunch of bacteria in there that are not good. They're floating around in the intestine, and you're causing problems. And so dysbiotic guts tend to have lower good guys as far as your good bacteria and higher amounts of the bad guys. And so like I said, you see this in about 70 to 80%, 83 in one study of people that had IBS had dysbiotic guts. And what you have to do is clear out that bad bacteria. You have to make sure you're eating diets that are appropriate for your specific nutritional situation. And this is probably the easiest one to take care of. See it on a stool test, and it will show us what exactly is going on. Number 2, similar to this, will be SIBO. So small intestinal bacterial overgrowth. Kind of the same as gut dysbiosis, but SIBO means that you have more bacteria in your small intestine than you do your large intestine. There should be a lot more in the large intestine. And once these bacteria get into that small intestine, you will have SIBO. You can have a breath test to test for this, to confirm that. But same situation, you got some bacteria that aren't supposed to be in there. You have to clear them out. Once you take care of both these dysbiotic situations, the irritable bowel tends to get better. You know, you're not having all these bacteria irritating the lining of the intestines, causing inflammation. So antimicrobial herbs, talk to your FM doctor for your specific stool analysis, what you should use, because strains require different antimicrobial herbs. No, you don't need antibiotics for a lot of this stuff, and sometimes it will make things worse. A chronic antibiotic use typically leads to these two things, so you don't want to do that. Number 3, infections. And this is going to be infections by things that you would never think of, but are so common. I actually have a patient coming in tonight. The last patient of the day has been suffering with IBS for about 7 years. We did a stool analysis. Sure enough, he has a parasite. Had no idea. And so our treatment protocol for him will be some antimicrobial herbs specific to parasites, some probiotics specific to parasites, to slow things down and calm down that issue. You'll typically see ones like Giardia, you'll see ones like B. hominis, Blastocystis hominis. These are more common than you think. You can pick these up anywhere. It's you know, you drink water, you touch things, there can be parasites anywhere. So if you have these symptoms, the IBS, check for infections. A good amount of people with IBS do have underlying infections. We got number 4, leaky gut. This is one that we, again, talk about all the time, and I've made videos about. Leaky gut will lead to IBS because you're obviously breaking down the inside of that intestinal wall. Things are leaking through, you're causing inflammation. That intestinal barrier is irritated. That causes those spasms of diarrhea and constipation and back and forth. Again, test for this. You could do a stool analysis. You can have your food sensitivity test done. You can check for calprotectin, zonulin. All these things will tell you if you have leaky gut. Then you start to seal it up. There are many different things. Amino acids would be one thing that can help seal up the inner lining of your gut. That helps calm things down. Again, as we see with the top 4, as these go away, things get calm, the IBS goes away. And that leads us to our final one, because we just mentioned it. That would be food sensitivities. And specifically, you're looking at people that might have a gluten allergy but are not celiac, so non-celiac gluten sensitivity people. And you'll see these people have dairy issues, grain issues, gluten sensitivity issues, and what you're finding is, again, the sensitivities mean that when you're ingesting those foods, inflammatory reaction, immune reaction triggers the IBS, okay? So all 5 of these things are triggers for IBS. That gets things started. And really, when you take care of all these, when you identify your food sensitivities, remove them from your diet, you heal up the lining of the gut, you kill off that infection, you kill off the small intestinal bacteria, and you get the dysbiosis of the gut normalized. These IBS patients tend to get a lot better, and as we know, and especially if you do have IBS, when that settles down, man, it is a better quality of life for you. And then we have, you know, these nervous system issues, anxiety, mood, depression, start to go away. So don't think it's reversed, and that's what most doctors are going to think. We're going to give you some suppressive symptom type of medication. In reality, a lot of these things are doing more harm than good. Like, for instance, your infections, number 3 here. The reason people have these parasitic infections, yeast and a lot of things, you know, chronic use of omeprazole and these heartburn medications that raise the pH in your stomach and allow some of these bugs to go from the environment into your body and proliferate. So medications aren't exactly the answer for a lot of your gut problems, and people with IBS know this. They're on all these meds and it really doesn't change anything. So once you figure out whether or not you have IBS, remember the 3 things that you'll check for is 3 days or more of abdominal pain in 1 month consecutively, along with it feeling better after you have a bowel movement, or it's triggered by the frequency of when you have a bowel movement, or the difference between consistency of the bowel movement. When that's triggered, you can bet you probably have IBS. If that's the case, come into our office, we'll test for these, see which one you have, or multiple ones, clear them out. Usually gut protocols don't take more than 2, 3, 4 months. Sometimes if you have a parasite, a little bit longer. That's it. You get that quality of life back, anxiety goes away, depression starts to go away. Obviously, there's other issues. I'm not saying that's a guarantee, but it's a great place to start. If you have any more questions about IBS or obviously any more gut things, please DM us or email us at info@fhccarolinas.com. Look forward to next week at another Whiteboard Wednesday.